93.9 Mike FM. It's Darren with you. Little Humans in Tune segment today. We're going to have a chat with our friends from Mercy Health and SEMO Food Bank. We're in the month of September, and I want to welcome into the studio Erica Robbins from SEMO Food Bank and Angela Head from Mercy. Welcome to the studio, guys. Glad to have you here.
Thank you. It's good to be here.
Yes, we're glad to be here.
We're in the month of September. SEMO Food Bank, you guys stay on our radar a lot because of the hunger need in our community. But this month in particular, let's talk a little more about health and hunger and where that focus is.
Of course, it is Hunger Action Month in September, and we raise awareness around what we do and the communities we serve, and of course, the individuals who are most impacted. And so we definitely see this beautiful connection between the food and the healthcare systems.
Right.
And so where health and hunger come into play is an area where we believe we can support. And so we have partnered with Mercy Southeast in the produce prescription program, which is a beautiful connection between the two sectors. And healthcare providers within the network prescribe fresh fruits and vegetables to individuals who are either managing a condition or want to prevent one from developing, want to lead healthier lives. So we come in partnership with Mercy to provide the food side of the hunger, and then they provide the health side.
I think that's a really awesome collaboration. I'm not a big fan of pharmaceuticals, right? So we like to keep medications down, and for you to be able to approach this as this is a food necessity. If they were eating these things the right way, this would really help with whatever it might be, recovery or the condition itself or so forth. So as you see this partnership working, probably too, a lot of times what we hear from folks is, well, I can't eat that way because that produce is too expensive, or I can't get to the store enough to keep fresh produce going on a regular basis. So a lot of the processed foods come into the mix, and we know how much that can affect our health across the board. Mercy being a partner with this, as you see this, how does this work for you guys in practice? I think this is a really cool idea.
Yeah, it's really been a great project. So our role as the healthcare providers in this is we, quote unquote, write the prescription for the fresh produce. We identify these patients in our ambulatory clinics that have chronic diseases such as diabetes, heart disease, obesity. Sometimes we don't think of that as a chronic disease, but it is. So we identify those patients as well as identifying if they suffer from food insecurity, meaning that they don't have the financial means to buy those fresh fruits and vegetables, which we know can be very expensive. We identify those patients in the clinic. We talk to them about the food bank and their programs and resources that they have. And if they're agreeable, we go ahead and give their information to Erica and her team. She reaches out to them and gets them enrolled, and the process is going.
That's awesome, Angela. And yeah, you almost see it as a healthier prescription, and you don't think of it as an alternative medicine because this is food that we should all be consuming on a daily basis. But for you to be able to identify and really, sounds mechanical, but efficiently deliver what is needed to the people that need it. I mean, that just further narrows the mission of SEMO Food Bank and what you guys are trying to accomplish. I'm a farmer kid, grew up, and we kind of think old school fall harvest, this is we're bringing in the sheaves and such. But as we think towards fall, a lot of our minds turn to Thanksgiving dinners and these kind of things. Whereas the food bank is, we're in that harvest season. So those readily available produce items are getting more expensive. All things political considered, we're not just bringing as much in from Mexico and South America and so forth as far as those fruits and veggies go. So that you being able to step in that role, that's a critical piece.
Yes, and you really have identified what we're doing. It is a way to show that food is medicine. I'm a farm girl too, and I think we all know food is personal, and whenever you can feel that self-sufficiency, confidence, and really overall wellness that a healthy diet can bring to you, I think that helps an individual feel good, whether it's their physical health, their mental health, their social, emotional, behavioral, all of the areas of wellness. So yes, in this harvest season, it's really, really cool what we've been able to do. We work with a vendor who is incredibly open to sourcing local foods. Whatever they can get within our service area, they do, and then whatever they can provide us from Missouri, they do. So we have a really kind of three-way means of communication. We do work with the healthcare providers and the dietitians at Mercy Southeast to know what diets an individual might need to follow. And then we ask the participants, what would you love to have? What would you like to see in your prescription? And it's really been wonderful to see what food we've been able to provide them and see their faces light up with bountiful items. I hear abundance a lot, and you can really understand the gratitude that our participants have by being part of this program and saying, oh my gosh, an abundance of, sweet potatoes. We just got beets and ears of corn and really beautiful items.
Color and fresh. And I think this is a trickle down too, because some of them are going home to feed their family with this, right? And so their kids are learning to pick up on more of, instead of chips, we sliced up a bell pepper and had that for snack or something like that. They're able to kind of replace some of those things that have become a regular rotating, not the most healthy choices. And hopefully through both of you guys participating in this, we'll see a reduction in that obesity rate. We'll see a reduction in the diabetic reporting coming in and all these kind of things. So it's a great strategy. I think it's great because it's a guided strategy. I think a lot of us have the best intentions to eat healthier, and when they're pursuing food through the food bank or through the local pantries that you guys are helping out with, that's not necessarily first in mind. It's what are we going to eat through the weekend? What are we going to eat this week? And not what can I do to change my diet or to make me healthier to help my heart disease issues or things like that. So I think you guys being able to guide this, it really is a hand in hand, the science of the medicine along with the big heart that comes from the food bank. So it's a great combination. When we look towards, if you're listening and you're like, okay, well, that's awesome. I'd kind of like to participate in that or whatever, or my doctor, is in the Mercy system. How do I become a part of this? So what's the best next step for people as they do that?
If they already have a Mercy Southeast provider, they just need to reach out to their office and they know the steps of how to get them connected. And then we kind of take it from there.
And if you're thinking, okay, I'd like to do this, just mention that produce prescription plan. It's kind of the moniker you guys have attached to this. So, and not everybody obviously is going to qualify for this, just like, not everybody's going to qualify to get food from the food bank directly as well. But we're encouraging people to take these options, make these choices. And I know you provide some guidance to that. What should they do outside of the circle?
We really have a robust system of services that we can provide, not only from the food bank, but with other organizations throughout our communities. We serve 16 counties, so we're pretty in tune with what those communities have. So individuals from St. John down to Pemiscot, all throughout our 16 counties, can contact the food bank. And we work with several health departments as well as the university here in town and their Masters of Applied Nutrition program. So we can connect individuals to experts in their area to provide nutrition education, to let them know about wellness opportunities. Here in Cape, Mercy Southeast has cooking classes. And so we can always inform individuals about things that are going on in their area, as well as services that the food bank has. And we have a robust, again, system of programs for veterans, for children, for the general public, and we can always connect them with what they need.
It's a great resource for us. And again, if you're listening in and you're interested in this, reach out to them and just ask some questions. Make it a part of your life. It'll help you change for good. And again, maybe be able to pass those changes along to those you live with and those you love as well, too. So the parameters to get into the program are pretty flexible. A lot of different people are able to take advantage of this. And it's not something that's starting next week. It's something you guys have had in place. And it's rolling already. It's already affecting lives. I know you said you had somebody that you kind of had a little testimonial from that you'd talked to them and already had that impact. That's pretty awesome.
Yeah, absolutely. So our individuals come to us at various stages of their life, and we never know what they might be going through. And so I was speaking with an individual the other day who they've all become like family to me. And she was kind of tiptoeing around the fact that she didn't really want to come to the food bank at first, but her aunt was telling her about the produce prescription program, and they are both now participants. And so she told me that after coming, after chatting, after having the opportunity to socialize, she started to feel alive again. She said, I wanted to cook. I wanted to do well for myself. I wanted to feed my grandkids better. So like you said earlier, this program crosses generations. It brings families together. It makes people feel alive again. And it really shows what food can do.
That's a big valid point. And I'm, like I said, I'm the kind of the cook of the house, and being able to cook with color and fresh ingredients and have some new ideas and do something that you eat and you're like, whoa, that does actually taste good. And I made that. And yay for me. And I can do that again anytime I want. You're enabling some championship action out here. I think that's great. It is a fantastic program. We're excited about it. Today, Erica Robbins from SEMO Food Bank and Angela Head from Mercy. Thanks so much for hanging out with me.
Thank you for having us.
Yes, thank you. It's been great.
And that's going to wrap up our Humans in Tune segment today. I appreciate you coming in. Of course, you can always find this on our podcast as well at 939mikefm.com or wherever you listen to your podcast. Just search 939 Mike FM, and we will see you next time on our next Humans in Tune.